All right, welcome. Good morning, good afternoon, and good evening, everyone. Welcome to UCSF Center for Global Nursing's Global Nursing Impact Series. As many of you know, this series aims to provide a platform for our nurses and global partners to share their remarkable work and offer insights and inspire our global community. Following the presentation, there will be a short Q&A, so feel free to write your questions throughout the presentation in the Q&A box. My name is Rebecca Silvers, and I'm the director for UCSF Center for Global Nursing. And it is my pleasure to introduce today's speaker, Judy Khanyola. Judy is a registered nurse and midwife and recognized nursing leader with over 30 years of experience in clinical nursing, education, and leadership. She is a fellow of the American Academy of Nursing and a Harvard Burnett Trust for Nursing Fellow, graduating from the inaugural class of the Harvard Global Nursing Leadership Program. Judy currently serves as the Vice President for AfReHealth, Africa's convening health professions education and research organization, which grew out of PEPFAR's health workforce capacity building initiatives for doctors and nurses, MEPI and NEPI, for those who are familiar. She is so many things. She is an AfriPEN, Africa's Interprofessional and Collaborative Practice Organization Vice President and Advisory Board Member for AfriPHC, the Primary Care Health Center organization, as well as an advisory member for um, Global Nurses Caucus and the Primary Care International. She is an incredible nurse leader, and if we had all day, I could go on about accomplishments across the board, bringing up nurses. And I am excited to welcome Judy to share her insights on African nursing leadership. And please join me in giving Judy just the warmest welcome. Thank you, Judy.
Thank you, Rebecca. And I hope you can see me and hear me.
Yes.
Yeah, great. And I'll just get right into it. Rebecca, thank you so much, and UCSF for giving me this opportunity to talk a little bit about Africa. And so this morning for you, it's afternoon for me. And as I speak, you're going to see it getting darker and darker as it gets towards evening. It's 5 p.m., and by 6 o'clock, it gets dark here in my side of the world. And so I want to really thank you for the opportunity and hope that in these few minutes that we have together, you can have a little bit of chance to come to Africa to hear what we are doing, to understand better, and possibly moving forward, foster collaboration, partnership, and continue to do and walk this walk that nurses do, wonderful work that we do in the world. So I'm going to talk about developing nursing leadership for Africa, the status and the challenges, and a little bit about the way forward. So, like I said, now you have to close your eyes and come with me on a tour to Africa. And when I was preparing these slides, I said, it's important when we look at leadership, not to look at it in terms of great leaders that we know or great presidents or great, I don't know, CEOs or heads of industry, heads of business or Nobel Prize winners, etc., but to look at it from the lens of ourselves as individuals. And Africa, unfortunately, because of that, suffers from a lot of prejudice. So today I'm going to take you on a little bit, can I say, not so pleasant tour when I look at prejudice and start my talk around looking at prejudice. And by the time I finish, you'll understand why I looked at it this way, because it really underpins nursing leadership, and particularly for us here in Africa. So when we look at nursing leadership, first of all, we want to identify, expose, and address what is nursing leadership. And I'll start by saying, in the past, this is in the past, France and Portugal, they said, oh, we must civilize Africa. What should we do? We'll colonize it. There's a Belgian cartoonist called Herge. And when I was a child, I grew up reading these Tintin comics. I like them and still like them up to date. Very interesting. But there was a depiction of Africans as childlike. And of course, when Herge was writing the Tintin comics, that was in the 1930s, about 100 years ago, that was the understanding of Africans, that we are childlike. The Germans credited African accomplishments to a Hamitic race descended from European settlers. This has actually had a repercussion. For example, in the Rwandan genocide, I've lived in Rwanda for the last 5 years. I was the chair for the Center for Nursing and Midwifery at UGHE. And the Rwanda genocide in 1994 stemmed to a large extent from these underpinning mentalities where they would say that Africans, who looked a certain way, were more Caucasian, lighter skinned, with longer hair and thinner noses, and so on and so forth, descended from European settlers. So anything good that came out of Africa was and often still is credited to some kind of link to Europeans. Italians stereotype Africans as illegal immigrants and beggars. The Polish understanding of Africa is influenced by its press, where we are often depicted, with bad and alarming news. In the 19th century, we had scientific racists, and they used this issue that justify that Africans were, can I say, like ape-like, close to ape-like, and it's used to justify all sorts of things that they did against Africa. Another stereotype in America is that the African continent is seen in the way that we are violent, we are poverty stricken, and again this dating back to stereotypes from colonization. Japan sees Africa as a continent in need of help, as does China. In actual Chinese internet culture, unlucky or incompetent video game players are called Africans, a reference to the association of black faces with bad luck. In the United States, Africa is seen as primitive and full of disease. Africans are often seen as peculiarly vulnerable to disease because we are depicted as a continent of disease. Africa is seen as sparsely peopled jungle full of wild animals, and the American cinema has been blamed for many, many years for disparaging stereotypes of Africa. Sometimes when you watch things like Coming to America, which I like, Eddie Murphy's movie, but it really doesn't give an accurate picture of Africa. So we have a lot of prejudices. Bias number one, Africa consists mainly of dry savanna plains. This is not true. I live in Nairobi, and I can tell you by the time it gets to evening, I'm going to put on a sweater because it's cold. We are right at the very high elevation, and if you go a little bit north where I'm sitting now, you will get snow on Mount Kenya. Africa is bloody hot. Again, this is not true. This is Table Mountain in Cape Town, and I can tell you Cape Town experiences snow. Everyone in Africa is poor. Again, this is a depiction of a typically urban place you find here in Nairobi, in Cape Town, in Johannesburg, in Kampala, in Kigali, all the main capital cities and big towns of Africa. People are affluent, people live in ordered cities. Again, a stereotype and a prejudice. In Africa, everyone lives in clay huts and there is no Wi-Fi. Again, like you can see, this is a depiction of a bustling market in Zanzibar. This, again, is not true. Africa is full of scary diseases, and Africa is dangerous. No different than any other capital city you walk in Europe or the United States. Again, these prejudices then kind of, can I say, underpin how we think about ourselves. And this is forming kind of my foundation for what I talk about for the rest of my talk. So when we look at nursing leadership in Africa, then having understood that bit of background, then we see that there is little, and this is now telling us the status as we are, there is little evidence on nursing and midwifery leadership in Africa. So we really don't know what are the dynamics around nursing leadership. If you read textbooks, for example, in the United States, they'll really give you a history of nursing leadership, of nurse leaders, of people like at the Red Cross. There are so many great leaders I've read from the United States who did fabulous work right from the olden days. In the UK, you read about nurses, from Florence Nightingale right through to now, wonderful nurses who have shaped public health, global health even. But in Africa, we really have very little evidence on this. Again, there's evidence that African nurses and leaders and midwives are less involved in health policy development, again, out of the colonialism that I've just talked about, often patriarchy. So, for example, many of the positions in leadership in many of our healthcare organizations, health systems, hospitals, healthcare facilities, they are often doctor-led, with the sense that nurses cannot lead. Nurses and midwives that lack effective advocacy skills, attributed to a lack of leadership training at both pre and in-service level. So when we go to nursing school, we are taught all the clinical things. We are taught about nursing care. We are taught about ethics, medical, surgical, pediatrics. We go through all the clinical things. Hardly do they teach us leadership. And even as you start working, when you graduate and go out into the workforce, we hardly get any leadership training. There's also the sense, because nursing is female dominated, the gender inferiority. We are often, especially here in Africa, because of patriarchy, women are not supposed to be forward. Women are not supposed to be assertive. We're supposed to be submissive, subservient. We're supposed to be in positions of serving, etc. Again, this also plays a part towards really having a lower status, lower development of nursing leadership in Africa. We have 4 governance structures for nursing in Africa. They're called the Quad, and they start with number 1, the Ministry of Health. And there we normally have either departments of nursing or the Office of the Government Chief Nurse or the Director of Nursing Services. Different countries call it different names. But basically at the Ministry of Health, there is an office or a department of nursing and midwifery. And this one is often involved in policy making that shapes the profession. Then the second arm is the regulatory body that deals with education and examination. So how, what is the requirement for someone to be registered? What is the minimum, education you need to undergo to be an ex-nurse, and so on, and the exams related to that. And then even after you qualify, the continuous professional development by the, like in Kenya, we call it the Nursing Council of Kenya. In Rwanda, it was called the National Council for Nurses and Midwives. In Uganda, it's the Uganda Midwives Board. In South Africa, it's called the South African Nursing Council. So every country has different names, but basically that regulatory body. The Nursing and Midwifery Professional Associations, these are related to the welfare and status of nurses. We have association, professional associations. So nurses can belong to, Pediatric Association. I belong, for example, here in Kenya to the National Nurses Association of Kenya. There are labor unions as well that deal a lot with issues around our welfare, our working conditions, our remuneration, etc., etc. And then, of course, the last one is the education and training of nurses, academia, your training institutions, and so on. So these 4 then are the governance structures of nursing in Africa, and they play a very, very important and integral part in nursing leadership for us here in Africa. When we look at developing nursing in Africa, and here you can see this picture where it says NEPI, and Rebecca, when she introduced me, talked about me being the president of AfReHealth, which came out, vice president of AfReHealth, which came out of NEPI, which simply stands for Nursing Education Partnership Initiative. It was a PEPFAR-funded program that really did tremendous work in strengthening the nursing workforce in Africa. And we know that nurses are at the epicenter of efforts to respond to global health crises. And we have a worsening global nursing shortage. Actually, by the time this statistic was being written, I think it was even before COVID. So post-COVID, these figures are even worse. In Africa, our nursing stock is only expected to increase by 6%, which is far below the 8% threshold set by the WHO. And therefore, so nursing leadership is needed to build a stronger, more resilient public health infrastructure that allows us to improve health, promote equality, and support economic growth. I mean, there are studies, and I'm sure all of you know, there's no doubt about it that a healthy population equals a healthy economy. If people are sick, they cannot drive the economy. So we need to be well to be able to drive the economy of our countries. And nurses play a really big part in this. And often I feel so sad that, the decision makers and policy makers don't pay attention to this and realize what an asset and what allies nurses can be in really developing a healthy population that would then drive a good economy, a robust economy, a growing economy. These are just a few of the nursing leadership programs that we have. And the JHLDP, this just simply stands for the James Hakim Leadership Development Program for Nursing Leaders. It's a program that I run at AfReHealth, which is, a continental body that looks at health professions, education, and research in Africa. And we got some generous funding again from the United States through PEPFAR funds to train nursing leaders. I'll talk a little bit more about this. There is also, again, through collaboration with the Harvard T-Chan School of Public Health, the African Union, and Africa CDC, they developed a global public health nursing leaders program, of which I was one of the inaugural students. It started in 2022 through 2023. Now they're in their second cohort. We have the Leadership for Change program that is at the International Council for Nurses, specifically designed for African National Nurses Association. And then at my former university, UGHE, I developed the Executive Education and Masters in Global Nursing Leadership. And this here is actually the flyer for our first cohort of leadership across Africa. You can see the former chief nurse there, our former Vice Chancellor, Professor Agnes Binagwaho. This is in Rwanda, current Deputy Vice Chancellor, Dina Bebe Bekele. And, we really have, and I think now we are in our fourth cohort into the fifth cohort next year, executive education. And we started last year a master's in global nursing leadership, of almost the first of its kind in Africa, that's looking at developing the leadership capacities of nurses and midwives in Africa. I'll talk a bit about the James Hakim Leadership Development Program. Again, through funding from PEPFAR, we developed the curriculum by 15 nursing and midwifery leaders from Africa. We had the first cohort last year, which was the English cohort from May through November, and 55 participants graduated. It's made up of 5 modules that you see there. And this year we have the second English cohort and are actually commencing the first French and the first Portuguese cohorts, just taking into consideration or cognizance of the Francophone Africa and Lusophone Africa, the language boundaries in Africa, so that each and every one of the nurses within those geographical areas also undertake this leadership development. And it's training clinical nurses and midwives. It's an online program using a case study approach and focuses on health system change to improve population health. When we look at developing nursing leadership, it's important, I think, and often some of the things that we need to consider are what is leadership. So we have leadership in these 4 spheres: politically, clinically, academically, and executive. And I think leadership is important in all the aspects. So for you to be a good leader, you can't forget, for example, the politics of it all. How do you maneuver politics? As you know, politics is often, people deride it, but it's like a lubricant. And if you're not politically savvy, you reach somewhere and you're going to stall in your career, in your growth. So it's important for nurses to understand what is political leadership. How can I leverage this as a nursing leader? What do I need to do? What do I need to learn to understand, to be able to maneuver the politics? I'll give you a very, interesting example. In Rwanda, they, after the genocide, as they were rebuilding the country and rebuilding their health system, they actually then put in place the office of the government chief nurse at the Ministry of Health in Rwanda. But again, because of politics, something went wrong, and this position was scrapped. So right now, We don't have, though there is not a government chief nurse in Rwanda. It was there in the past. And that can sort of tell you how politics can come in, because for one reason or another, nurses were not able to play the politics well. This office was scrapped. And you can see it deals a very big blow to the nursing profession if we don't have this chief nurse at the Ministry of Health, because as you know, a lot of, especially here in Africa, similar, I guess, to the US, again, your Health and Human Services, it runs a lot and it plays a big part in shaping the healthcare landscape for that country. When we look at clinical leadership, many times nurses, we do focus here, and that's good because a lot of our work, of course, is clinical. And so it's important to, what is the clinical leadership required for me as a nurse? If I'm a nurse and I'm in the clinical area, what skills do I need? What do I need to know? It won't do well for you if you don't understand, for example, what's the latest technology around transplants, kidney transplants, or what's the latest technology around triple bypasses, cabbages, or things like that. So then when you're in meetings or you're somewhere in a position of leadership, you're blank because they're talking about something you have no clue, you have no understanding. Of course, in academia, like me, who's been mainly based in academia, I'm teaching all the time. I need to understand, how do I teach? How do I teach well? How do I make sure that nurses are well developed, so we produce good nurses, and then we make sure these nurses, once we produce them, we continue to ensure that they keep up with the skills and knowledge. Academic leadership is very important. Nurses should rise to positions of being deans and vice chancellors. These are not positions just for medical doctors, so we should aspire to that. And of course, executive leadership is important. When you're in a position of leadership, you need to understand, how do you manage budgets, how do you do your human resource, how do you allocate time, etc. And all of this falls and makes the nursing leadership important. Of course, this does not go without challenges. So we have challenges. And again, why I started by talking about prejudice. I think for me, the first and most important thing we must deal with is prejudice. And prejudice is internal. So me, myself, as Judy, I have prejudices, of course, and they shape us, and all of us do. And it's not that they're bad. They're things that are part and parcel of the society and what shapes you. But understanding that I may have a prejudice, or I have a prejudice, or, oh my goodness, I realize now that I have a certain bias, a certain stereotype around certain things. How do I then learn and make sure that I come out of that into something good? Then, of course, we have external prejudice. So the prejudice that comes at you from patriarchy. For women, for example, often the male of the population do a lot of damage to females. We know that. We've probably experienced it in our lives. It results, for example, in nursing leadership with insufficient resource allocation. So if you have a department of nursing in the Ministry of Health, but the whole department or the Ministry of Health is led by a doctor, most of the time, because of that prejudice, they're like, oh, these nurses don't need a lot of money. We don't need to give them enough resources. They can just make do with this little. And that then results in challenges within our profession. For example, policies also are often made without nurses on the table. So you'll find from nowhere a policy has come and they're like, but if they had a nurse on this decision-making table, they would have asked certain questions, and therefore this policy would not have been put in place, education, regulation. So that means then an external locus of control for nurses is that we are often controlled externally. Anything we want to do within ourselves as a profession is controlled by someone. So you have a budget, but you actually have no control over that budget because it's being held by somebody else who decides to give you whatever they want to give you whenever they want. Things like task shifting came, and often I find that task shifting has caused more problems in Africa than it came to solve. It's really made a mess of things, and even now more and more people are beginning to see that it wasn't very useful because there is a lack of clarity within our scopes of practice, within our roles. Like now in Kenya, we have a big debate whether we need this role called clinical officers. People feel they're obsolete. There's an issue. Clinical officers want to perform, for example, cesarean sections. The doctors are up in arms and they're saying they're not trained enough to do this. And, so a lot of that then has resulted in again, this task shifting has made a mess of our health system. Geopolitics, I think we are all familiar with that. The migration, when we have very poor, can I say, a workplace environment within many of our African countries, we are poorly paid, etc., etc. You find that then people migrate, then there's brain drain, there's all this up and down. Some countries like Zimbabwe are even saying it would be a crime for nurses to migrate, which, as you know, is against human rights, things like that. Is isolation and nationalism. So these are the challenges we face. Climate change has come in, it has increased the disease burden, it has resulted in the epidemiological disease transition. We have now more epidemics and pandemics. Armed conflict doesn't help nowadays. Almost every morning you wake up, there's another war somewhere or some conflict going on somewhere. And all of these are challenges we face within our sphere, and that we need to address through the lens or the strength of nursing leadership training. When I look at the way forward, I think the first thing is important is reflection and reflexivity. And I hope that this talk that I've had this afternoon with all of you helps you to reflect a little bit in yourself. What are my prejudices? What are my biases? What can I do to mitigate that as I do my work as a nurse? And that requires leadership of yourself and a real hard look at yourself, and often it's not easy. So as you grow into as a nursing leader, you really need to have the courage to be able to address that. Partnership and collaboration, I mean, Rebecca and I, fabulous partnership, fabulous collaboration. In just a very short time, I was just starting to talk to Rebecca at the beginning of this year, and in just the last 3 months, really felt that, she understands. We work so collegially together. We collaborate. There is no sense of someone is above the other or someone is less than the other. And there's such give and take. And this is so useful. And because of that, I'm actually here this afternoon or morning talking to you. We need leadership training and immersion. That's so, so important. You can't do what you don't know. So we need to know. Mentorship goes without say. We need decentralized governance structures. So, for example, we cannot have everything being done at one central point without understanding what's happening at the periphery. When you're a leader, doesn't mean you hog all the limelight, you hog all the information, you hog all the resources, but that you empower others and you decentralize. And you find that that makes things so much better. And of course, without, say, cultural humility, again, going back to colonial, pre-colonial days, even currently, a lot of what we see in the world today is not so good. There's a lot of racism. There's a lot of, lack of empathy. There's so much anger and so on and so forth. Really, all of us need to be culturally humble. And this way, once we do that, then it stands us in good stead as we move forward to tackle the challenges that I mentioned. This is just a quick quote from the Africa Agenda 2063. The people of Africa had diaspora united in diversity, men, women, girls, and boys from all walks of life, deeply conscious of history, express our deep appreciation to all generations of those who went before us, who bequeathed us an Africa with an exemplary successes in the fight against slavery, colonialism, and apartheid. And this is really important as we grow forward into developing, remembering the past, not going back to the past, not dwelling on the past, but moving forward, understanding that history, but that then we want to move forward so that then we get, exactly what I'm calling here, the nurse that we want. Thank you. Rebecca, back to you. And there are references here if you need, and I thank you.
Thank you so much, Judy, for your incredible talk. The work that you and the organizations you're working with to develop nursing leadership is so essential and important. And I think you really highlighted some of the reasons why. And it's, even across any country in the world, we're really working on nurses are the biggest profession. We are so present in healthcare systems. We have such an important and vital voice to contribute. And historically, there hasn't always been that opportunity. And to your point, that skill set to be able to develop to develop and to be able to share and shine. We have one question in the Q&A. Grace, I actually don't know if this is a question, but Grace was just maybe a comment. Nurses do need leadership training and mentorship, but often those who emerge remain focused on nursing practice in the confines of traditional healthcare spaces. While workforce and
Mm,
practice will remain undeniably important, there is a lacking component on developing nursing in cross sectoral
mm,
and interprofessional levels. Doctors, lawyers,
mm,
etc., often leave their
mm,
traditional practice roles to translate their skills
mm,
elsewhere. For
mm,
nurses, using their informed lens can ultimately drive and affect
mm.
positive
Yeah.
impact and health for all. What is the way
Mm.
forward for modern nursing from this perspective? And she says they miss you at UG.
Oh, I miss you too. Thank you. I think for me, again, why leadership development is so important, because that will then mitigate that exact what you're saying. Because doctors do this, even as they train to be doctors, they're almost from day one uh, told that you're a leader, you know. So you're the leader of knowing what's wrong with the human body. So if you're a surgeon, cut, remove, you are the leader in that. I am the one who's going to cut and excise this appendix or whatever it is. So right from the training that you start to develop a doctor, they come out knowing I'm the leader, and they don't even think twice about leading. They don't think twice about going for whatever it is they want to go. But for us as nurses, we are often told, we are almost all the time told, you're serving. And while the fact that we stand in and we serve our patients, we advocate, and I like that very much about our profession, that does not preclude the fact that we too are leaders. In fact, the very fact that what a patient wants holistically already, in my view, makes you a leader. Right there, the fact that I can know my patient is dehydrated and needs this at this point, that makes me a leader. That already gives me the power to speak out and say, look, you're developing a policy here that's detrimental to XYZ, because when this and this happens, this impacts a patient, this impacts the community, this impacts the family. The very fact that we are often trained to take orders doesn't augur well for us. And I think that has often been the reason why we are not quick to jump and go asking for promotions or moving forward or being aggressive. It's almost seen like, oh my God, how can you want to be the vice chancellor or the chief executive and so on and so forth, is not a good thing. I think we need to begin to teach right from the time we prepare nurses that they are leaders. Our leadership is important. Our leadership is critical and crucial. Particularly for me, I look at it in this 21st century with all the challenges we are facing right now. We need that humility that nurses bring. We need that it's not about me, but looking at others, about partnering, about collaborating. And I think nurses are fabulous in this. The holistic quality of it all, if that's even an English word. The fact that I can look at a patient and see their psychological issues, their physiological issues, even their spiritual issues, etc., family, and so on and so forth. That gives you a kind of, can I say, not a tunnel vision, but a very nice multitasking, if I can call it, way of thinking that allows you to look at things holistically. So it isn't about, oh, we are only just going to manage HIV patients. We have an HIV clinic, and you're like, well, this patient might be HIV positive, but they're also a mother. They're also pregnant. They also have a child. They are a brother and a sister. And how do we make sure the health system manages, as much as they're managing the physiological disease going on in the body, but that they're managing this person as an individual? And nurses would be fabulous in that. In fact, I think a lot of the crumbling or the lack of resilient health systems we have has come out as a result of that kind of one track, tunnel minded way of thinking that now we really need to undo. And I think nurses really should do this and work hard towards getting there.
Thank you, Judy. We have one more question from Mitchell Erickson, and he has written, what are the continuing education limitations across the continent in leadership? I feel leaders sometimes are led astray by the day-to-day crisis.
Yeah, that's very true. And again, like I say, if we rise to positions of leadership, we will allocate sufficient resources. The reason that we are always in a crisis is because we are not enough. So if it's just me and Rebecca on the shift and we have 60 patients, like I had when I was a fresh graduate, 6 months out of nursing school, I was alone on the night duty with 60 patients and one student nurse. Of course, you'll just run from crisis to crisis like a headless chicken. And so, enough resources are needed for, or at least the bare minimum for nurses to function. So you have to just say we must not allow for one nurse on the shift, so that there is an ability for you not to just move from crisis to crisis. We must be able to sit down and say, what will this take? And I think that can only happen if all of us here on this call, here on this webinar and beyond, aspire and strive to those positions of leadership where you can then say, okay, now as the government chief nurse of Kenya, I'm saying 1, 2, 3, and the government will listen because of the power of nursing in the country, and say we are no longer going to allow for this because nurses cannot just. But we've taken a beating for so many decades that now nobody cares. They're like, oh, nurses can do it. So I think that is important. Link yourself to organizations, the International Council of Nurses, do fabulous work, your own organizations in country, your associations, for you guys in America, I know you have your, what do you call them, your senators, and your, in Kenya here we have members of parliaments, politicians. Be on a political committee, sit there and argue with them and say, hey, I'm a nurse and I know what this means. You cannot do XYZ, you cannot pass this law. They'll be like, oh, okay. And it's amazing, actually, people really do respect nurses. Whenever I say I'm a nurse, I always see someone saying, really? And they look at me differently. So when you speak, you'll come with that voice of might, and that is very important. And I want all of you to get there, even if you're just the head of department. That makes a difference. It doesn't mean that we all have to be CEOs and presidents and so on. But for me, I'm like, you must go up within your career, be at the point of making decisions, then we'll see the differences. But I agree with you, it's not easy.
Yeah. Thank you so much, Judy, for this amazing and inspiring presentation and an important look at leadership across Africa. Your work is really uplifting the nursing profession, and we're so honored to have you here to learn about the impact of nursing leadership training and its potential. So thank you everyone for joining us today. What an exciting talk. We will have this recorded and available for anybody that wants to watch, and we'll share it afterwards. And we appreciate everyone. Thank you so much, Judy, and have a wonderful evening.
Thank you, everybody.